Good evening and welcome to the Sleep Center. I'm Dr. Norman, the Medical Director. We've put together this video to give you a brief overview of what to expect during your stay here. An attended sleep study, or polysomnogram, is designed to evaluate your sleep quality by looking at many different parameters. We have designed the sleep lab to be comfortable and used furnishings to make you feel at home. However, we recognize that it is impossible to truly mimic a home environment when you're in a sleep lab, as various sensors are needed to monitor how you are sleeping. Please take a moment to make yourself comfortable. A television is provided to help you relax, and Wi-Fi service is available. Please be mindful of other patients in the sleep lab who may be trying to sleep when adjusting your television's volume. Once you are situated, the technician will introduce themselves, give you some brief questionnaires, and begin applying the sensors that are needed for your sleep study. Elastic effort belts will be placed on your chest and abdomen to monitor your breathing effort. These may need to be a little snug in order to provide a proper signal. However, if they feel too tight, please ask your technician to loosen them for you. Sensors will be placed on your scalp to monitor EEG or brainwave activity. These sensors help us determine when a patient is awake and what stage of sleep they are in. 2 additional sensors will be placed on either side of your eyes to monitor eye movements, particularly during rapid eye movement or REM sleep. Sensors placed under your chin measure muscle tone. EKG sensors are placed on your chest to monitor your heart rhythm. Sensors are placed on each leg to monitor leg muscle tone and look for periodic limb twitches during sleep. Sensors will be placed near your mouth and under your nose to detect airflow during the night. All of these sensors are attached with long wires to a headbox unit that then connects to devices that allow monitoring and recording from the control desk. While the wires take some getting used to, you should be able to move from side to side and onto your back during the night without too much difficulty. During the night, technicians will be seated at the control desk monitoring your recordings. If there are any concerns, or if any of the sensors need attention, a technician may come into your room to make an adjustment. Each room has a video camera that is monitored by the technician at the control desk. Rest assured that the video recording does not leave the sleep lab. If you need to change, please use the restroom for additional privacy. Each room also has a 2-way intercom, which allows you to communicate with the technician at the control desk. If you require any assistance at any point during the study, please call out in a normal tone of voice and ask for the technician to assist you. They should be able to hear you over the intercom and respond promptly. However, the technicians may occasionally be in another room, assisting another patient, so please bear with them if it takes a few moments before they respond. Each room also has a touch-sensitive lamp on the nightstand. You may want to touch the lamp to turn it on as an additional means of alerting them. While the entire sleep lab is controlled by one thermostat, there are blankets available for patients who need extra warmth, and fans available for patients who feel too warm during the night. Please ask your technician for these items. If you need a glass of water, your technician will be happy to help. Lastly, if you need to use the restroom at any point during the study, the technician can help disconnect the headbox from the wall to allow you greater freedom of movement. If you meet certain criteria during the study, the technician may come in partway through the night to place you on CPAP therapy. With CPAP, a mask is placed over the nose, or over the nose and mouth, that is connected by a hose to a device that uses room air under pressure to help keep your airway open. If you've not experienced CPAP before, it may take some getting used to. Please keep in mind that the mask must form a good seal to minimize air leak, and is designed to help you breathe better once you are asleep. In the morning, the technician will come in to disconnect all of the sensors when the recording has been completed. The technician will also give you some forms to fill out that you will leave in the room. The technician will also give you a comment card to fill out, which we ask you to place in the suggestion box in the hallway by the entrance to the sleep center. Once the study is complete, the enormous amount of data that is gathered by these sensors is evaluated 30 seconds at a time throughout the entire recording. The sleep specialist will generate a report that highlights the findings and will send the report to your doctor, typically within 1 week. If you parked in the parking garage underneath the building structure tonight, you should have received a green validation ticket from the guard in the lobby that discounts your overnight parking fee. If you did not receive this ticket, please let your technician know, as you may need to go downstairs to collect one before the start of the recording. Thank you for choosing us for your sleep center needs. We hope your stay is an enjoyable one, and if you have any further questions, please feel free to ask your sleep technician.